All right, so let's start off with Shane and Jim. Welcome to the show.
Yeah, thanks. Michael.
All right. Shane, you were talking prior to the show about what's really going on, what's happened recently with the Trump administration, what they're doing with the insurance laws. Bring that out for us.
Sure. So the Trump administration today released a proposal, or yesterday, excuse me, released a proposal to expand the availability of short-term medical plans. And the goal with that is they want to improve accessibility and affordability to Americans. And the challenge is if you expand it, what they're trying to do is they want to go from 3 months to 12 months, and by expanding the availability, you're really introducing a lot of other financial issues that they're really trying to avoid. I think that. Jim and I were talking about this earlier, is if you look at the short-term plans, the ACA compliance standpoint, the mandates, they don't have the mandates. And so when you look at the mandates, where you have the 10 essential benefits or you have the pre-existing conditions that they don't have to follow, you're really going to struggle with Americans with affording basic health care.
Well, Jim, how do you see this? There's got to be some gaps in what's going on, because from what I'm putting together and the conversation Shane brought out, I mean, that it's really not going to do anything for anybody. Is that the way you see it?
Well, yeah. I mean, the problem that you run into is when someone enrolls in a short-term medical plan, it looks and feels like a major medical plan. The problem is that there's the pre-existing clause oftentimes is 3 to 5 years as a look-back period. So anything you've been received medical advice or treatment for in the past 3 to 5 years isn't covered. So, I mean, that could be a medication. It could be a doctor's visit said you need to watch your blood sugar. I mean, any of those records could be pulled into the equation and denied the coverage for those treatments, those conditions.
Ed, what do you think about that?
I think it just basically indicates that there's no real plan out there. Obviously, that's a little bit draconian to look at from that standpoint, but I think that with the original Affordable Care Act, obviously there was some things that they wanted to push forward, and I think there's a challenge in kind of unwrapping that act and, in fact, figuring out ways to do essentially the same thing but without the mandates. And I think that's where the secret sauce is going to happen going forward. So obviously having an expert like Sean here to talk about that makes a significant difference for us.
Yeah, what would you do different, Sean?
So I think that first, you have to have some protection in there for the customer. You have to make it financially viable in the sense that there's some protection. And what that means is that there's some pricing transparency, and people understand that if they go see a physician, they understand what's it going to cost and what's it going to cover. And the statistics show 62% of personal bankruptcies are related to medical bad debt. So I think that the Trump administration really needs to focus on not only an affordable solution, but a solution that's actually going to protect the consumers from this really this kind of bait and switch that the insurance companies have put in there.
Who's really behind this one? I mean, the presidents don't come up with this policy. They just push it along and decide after they talk to their advisory board that is it good or is it bad? Is it going to on multiple levels, and then they either sign it or they don't. Who's really behind putting something up like this? It doesn't work anyway.
Well, I mean, the insurance companies have a lot to gain for a plan that won't pay anything.
Right.
And the reason why it's so attractive to consumers is because the price point is probably 30-40% lower. And they've incentivized – the insurance companies incentivize the agents to sell it through higher commissions. So it's a problem because the consumer just doesn't understand.
Okay, so we're going to give you 30% lower on your bill, but it's going to be worse for you?
Well, I mean, if did
I get that wrong?
No, you got that right. You nailed it. I mean, if it doesn't cover your pre-existing conditions, or even come close to covering your pre-existing conditions, I mean, I can understand. If I had cancer last year and I didn't carry coverage and I bought that, maybe why they wouldn't cover cancer. But how about the acid reflux? That's not a really expensive thing to cover, but they exclude that too. And how about some of the other basic everyday medical expenses that you would hope that a plan would cover, that they're excluded. So that's part of the problem.
And they have $5,000, $10,000 deductibles along with 50% coinsurance. So when you get down to the bare tax, you're basically, why even have insurance? You're just going to pay for everything yourself.
You really are. You're self-insuring. If you think about it, if I'm in the risk business and I take away the risk, then what is my risk?
Exactly.
It's a money play.
It is.
Okay,
100%.
All right, Shane, what else do you have for us on today's show?
This was the biggest news for us today. I mean, I think that
how does your company deal with it then? So
Well,
this comes down and you have to deal with this now.
right. And I think that's what, you look at why we created Hooray Health. This is exactly the reason. We the transparency and the protection for the member, the consumer, is so important. And what we've done with our plan and our product is really protected the consumer from unexpected bills. We've reduced that financial burden by your basic medical bills. Up to $5,000 are covered, right? So whether you use us as a supplement or a standalone, and really I think for us it's just this confirms we're on the right track, and what we're doing really has purpose, and this is what consumers need.
Right, I agree.
John, in looking at, you said you could use it as a supplement or a standalone. Would you argue that the majority of the medical bills that people have, you mentioned that $579 is about the average people have. Would you argue that using a product like yours in addition to some type of major medical plan would probably be the most prudent way to go?
Absolutely. Okay. If you look at a $5,000 deductible and you look at our plan, our plan takes care of all your basic care for a $25 copay. And then if you have an accident, which is, if you're under the age of 45, that's going to be one of the most common reasons to go in and see a specialist or go in for an outpatient procedure. We have a $5,000 accident policy to cover that deductible. So for us, it's a supplement is a perfect complement to a major medical plan.
Why are people who are supposedly intelligent and educated in this particular area so non-educated when it comes to the simplicity of what you're doing?
I think it's just different in the sense of nobody's looked at it this way, and I think the challenge is, we're going for kind of the lower common denominator, and everybody else is kind of swimming up. They want the larger piece of the pie, where people are paying $1,000 for a policy as opposed to ours starts at $99. And so we really focused on the smaller individuals that can't afford it.
But even thinking of that, Shane, why wouldn't corporations embrace this?
They are actually. We're working with large corporations that are really, the feedback they get from their employees is that they're unable to use their plan because they have a $5,000 deductible, and if they can't use the plan, they're not taking care of themselves. They're not able to, they're avoiding care. And so what this plan really does for them, the large employers, is it gives their employees an opportunity to get their basic care taken care of and then have that catastrophic coverage.
Okay, we're going to have to close, guys. Shane Foss, thanks for being on the show.
Thank you very much for having us.
Jim Campbell, thanks for coming in.
Thank you.
All right, and today's segment is brought to you by thevitaminpatch.com.